Test, don't guess. You cannot out-supplement a bad diet. For them, iron is not really a vitamin, it's a necessity. Hello everyone, and thank you for checking us out. This is SAC Health Answers. I'm Dr. Jason Lohr. I am the CEO here at SAC Health, but I'm also a practicing family medicine physician. And today we have a great question from Benjamin. It says, hi, I'm Benjamin. I'm a 38-year-old male. What role does nutritional supplementation, vitamins, play in someone's overall health? Are they essential or just expensive urine? And that's very funny that you actually mentioned expensive urine, because in many cases, if you're taking vitamins that you don't need, they do come out in the urine. And it means all that price you're paying for those vitamins are just going into the urine. And that's why we call that expensive urine. Let's look at a general multivitamin. Ideally, we really should get all of our nutrients from our diet. If we eat a variety of foods, that's fruits and vegetables, whole grains, lean proteins, the truth is we can get everything that we need straight from our food. But a basic high quality multivitamin could fill in some gaps at times. But remember, it's not a substitute for real food. An orange contains things like fiber, phytochemicals, that a vitamin C tablet does not. So you cannot out-supplement a bad diet. That is key to remember. However, there are specific times where we may need something in addition to the diet. For example, vitamin D. Low vitamin D is actually quite common. It can be linked to bone issues. It can be linked to mood disorders, even a lowered immune system. We found this even with COVID. People with low vitamin D levels had worse cases of COVID. So for many people, especially in the winter, supplementation is vital, because remember, vitamin D comes from the sun. We don't get as much exposure to the sun during the winter because we're more inside. The days are shorter. So there are times where vitamin D supplementation is needed. The other thing is iron. Iron, especially in women who have maybe heavy periods, maybe those who are on plant-based diets are not getting enough iron in their diet, and their iron stores can drop. It can cause things like fatigue and even anemia. And in this case, for them, iron is not really a vitamin, it's a necessity. So in these cases, supplements aren't just good for you, they're essentially acting as medicine. So what role should a multivitamin play? Really a supporting role, and not the lead role. So if you're thinking about starting a regimen of multivitamin or vitamins in general, here's my advice. Test, don't guess. Before you buy expensive bottles, ask your doctor for a blood sample, a blood panel. Let them check things like a vitamin B12, like a vitamin D, like an iron level, and then treat what's actually low. Number two, look for quality. Make sure that when you're looking for these vitamins and multivitamins that are out there, look for things that actually have third-party verification. There are companies like USP or NSF, and these ensure that what is actually on the label is actually in the bottle. Super important. And then number three, check interactions. Supplements are biologically active. There are things like, for instance, St. John's wort, which can interfere with birth control. Vitamin K can interfere with blood thinners that somebody may be taking. So always list your vitamins when you see your doctor and when your doctor asks what medications you're taking. So thank you for that question, Benjamin. That's excellent. A lot of people have that question. I'm asked that question a lot by my patients. Thank you for joining us for this episode of SAC Health Answers. Remember, your primary care doctor is your partner in your personal health and wellness. So always talk to them about any questions you may have. Thank you for joining us, and hope you join us next episode.